Unmute. Good morning, everyone. My name is Stephanie Simpson, and I am the Associate Vice Principal, Human Rights, Equity, and Inclusion. And it's my pleasure to be your host today for this special online town hall for faculty and staff. I'm pleased that so many of you could join us today. I know that this is a very busy time for many of us. In a moment, we will be joined by Principal Patrick Deane, who will be answering many of your questions, as many as possible, within the hour and a half that we have today. And we are also joined by Mark Green, Provost and VP Academic, Donna Janiak, VP Finance and Admin, Kim Woodhouse, VP Research, and Jane Philpott, Dean of Faculty of Health Sciences, who will be available also to share their expertise. Before we begin, I'd like to welcome Jan Hill Ganushuni, Associate Vice Principal, Indigenous Initiatives and Reconciliation, who will open our meeting today. Jan?
Thank you, Stephanie. Good morning, everyone. I'm happy to be here with all of you today. Kunjokwa, Sawadahu Siyos, Gani Gariwesa, De Chidawanu Horado, Ne Sungwaya Dison, Ne Wahi Rosa Año, Ne Gari, Ne Ohandu Gariwadekwa, Ungawana Hetsu. Ona Sawadahu Siyos, Kunjokwa, Ne Egadi, Ohandu Gariwadekwa, Ungadi, Wanungode. Aguego unska, handiru wait nuni, ne ungwa ni gura dano de tinowarado ne aguego yunkieno wase, G o jade. Aguego unska, handiru wait nuni, ne ungwa ni gura dano de tinowarado ne aguego yunkieno wase, G karunhyade. Dana ona gadi, aguego, de chidwanu horado ne sungwa diso, to niodonhak ne izewat ni gura. Today, we give greetings and thanks that all the things on the earth and in the heavens continue to fulfill their responsibilities, even in the midst of all the challenges we're all facing. And by doing so, they therefore make it possible for us to continue to exist as human beings. We acknowledge and give thanks to the Creator of all things and the energy of creation that this is so. We also give thanks because even though we are faced with challenges in our work and our home life, we are still given another day to draw breath and to see the beauty of creation. Sego sewa gwego, wat kwanu horadu, kanu shuni yungyats, waganyatu, kanyuke haga, ni wahunjodum, gundege nida wagenu, gundege gunagare. Gano Shuni, she is making a house, is what they call me. I'm from Gundege, and that is where I live and work from now. I'm also Mohawk and a member of the Turtle Clan. Kanyunke Haga are relational people. Our original instructions as given to us by the Creator include our relationship and our responsibility to the land, the cosmos, and everything in between. These instructions embrace our oral traditions, passed down by our ancestors, and include our Ohandugari Wadekwa, our creation story, and our cycle of ceremonies. All the teachings we received from the Creator revolve around our duty and responsibility to respect and live in harmony with everything that has been provided for our use in the natural world here on Mother Earth. These original instructions are my worldview, my epistemology. And so now the words that come before all others have been said, and we can all focus on the reason that we've gathered here today. Today, I would also like to acknowledge that Queen's University stands on the territory of the Haudenosaunee and Anishinaabeg, and also acknowledge that many other nations of Indigenous people now call Kingston home. It's my understanding that this territory is included in the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and Allied Nations to peaceably share and care for the land and the resources around the Great Lakes. And so we acknowledge and thank our ancestors for continuing to live in a way that ensures we remember. As a clan mother in my community, I'm deeply committed to preserving and promoting Indigenous knowledges, histories, cultures, languages, spirituality, and traditions. As clan mother, I acknowledge our ancestors and I welcome you to these lands on behalf of our men, women, warriors, children, faith keepers, and leaders. Nyawak Giwahi. Many thanks.
Thank you very much, Jen. So just a few housekeeping items for today. I will be asking as many of your questions today as possible. And if you were on the previous town hall, you would know and remember that you can enter your question in the Q&A chat, which I believe is at the top right-hand corner of your screen. We've also had a number of questions submitted in advance, and many of them were similar, and so we've tried to group them together according to theme, and we will get to those questions during today's session as well. I've already seen in the chat that there may be some people who are having connection issues, and we just want to remind people that this town hall is being recorded and will be posted on the principal's website in the next day or so for anyone who was not able to attend today's town hall or who unfortunately was having difficulty hearing and seeing what was taking place. So to start then, I would like to ask Patrick. Patrick, if you would mind giving us a few opening remarks and maybe also a formal welcome to our new Dean of Faculty of Health Sciences.
Thanks very much, Stephanie, and thank you also to Jan for those inspiring opening words today. Good morning, everyone. Wonderful to be with you all today. I can't believe it was May when we held the last one of these for faculty and staff, and the intervening weeks have gone by very, very rapidly. And considerable changes in the context in which the university is working, and I think we will see very different preoccupations come out in the questions today, and I hope we'll be able to provide as many of the answers to those questions as we know. But thank you everyone for joining us, and as Stephanie pointed out, not only will the town hall be recorded, but we will try to answer as many of your questions if we have to by email as is necessary. But when I compare our context now to where we were in May, it is striking. You'll remember back in May, a lot of the questions we were trying to address had to do with the uncertainties of the fall, our not knowing what would even be possible or permissible under the public health guidelines for us in the fall, and some of that is becoming a little more clear. And similarly, the university has, by this point now, articulated some fairly concrete plans for the way in which the fall term is going to play out. Question marks continue to hang over the winter term, I have to say, and at some point in the conversation today, I imagine Mark Green will talk a bit about that. But either way, we're starting to see the fall take shape, and we have a sense of what proportion of our student body will be either in residence or in in-person classes, and what proportion will be largely working online. We've circulated some principles, which I hope everyone has found useful. These are principles for decision making during the COVID-19 pandemic, and they give an indication of how we're approaching this whole question of reopening the university's academic activities in a way that begins to approach our normal way of operating. And if you have any questions about any of those, do feel free to ask them during the course of this town hall. A lot else has occurred in the intervening weeks since that last town hall in May. Most obviously, a huge escalation in the consciousness of our university community of racial issues in response to the killing of George Floyd, a galvanizing of people and opinions around the Black Lives Matter movement and the gathering tide of support of that movement. Very gratifying to see and very gratifying to feel it in its presence on our campus. there was a very interesting initiative, I think very fruitful and productive initiative led by QVAS, the Queen's Black Academic Society, earlier on in this period. And the university, in dialogue with that student group, came up with, I think, some very useful plans for approaching the whole question of equity, diversity and inclusion, and particularly anti-Black racism at Queen's. But since then, we've had a number of other developments of a similar sort, and I will welcome a conversation about these today. There was the vandalism at Four Directions Indigenous Student Centre, really shocking incident, which I know has been very painfully felt by the members of our Indigenous community, and a troubling sign that some of the issues we were dealing with back in the fall around the Town Hall incident, well, it's no surprise they've not gone away, but that they are still present and active with the same intensity is very, very troubling indeed. And then most recently, the emergence of student concerns about racism at the Smith School of Business. Very courageous postings by our students about the conditions of work and life for Black students or students of color in Smith. And I know Smith is turning its mind to addressing those questions, but so too must the whole university mobilize on and against this issue. And obviously I'll be happy to talk a bit about that later on in dialogue with you. But I'll leave my remarks there. I think what I'd like to do now is sort of turn to the COVID-19 context and invite our new Dean of the Faculty of Health Sciences, Dr. Jane Philpott, to say a few words. It's my pleasure to introduce Jane to you. I think we're very fortunate to have her join our ranks, and I know everybody's already feeling the positive impact of Jane's presence amongst us. So I've asked Jane to say a few words about the public health landscape and the COVID-19 crisis and where she sees our situation right now. And then once Jane's made a few comments, we can turn to questions, Stephanie, if that's okay. So I'll hand over to Jane.
Thank you very much. Thank you, Principal Deane, for the very warm welcome and introduction. I can't tell you how delighted I am to have this tremendous privilege to be the new Dean of the Faculty of Health Sciences here at Queen's University. And I can tell you that I have been very warmly welcomed by faculty, staff, and students, and we have dug right into a lot of really interesting work. I want to thank Stephanie as well for her leadership today, and Jan for her opening remarks and starting our conversation in a good way today. I have been asked by you, Principal Deane, to make some comments in terms of the context of COVID. And, you know, this is a situation where I suspect most of the people who are listening in today are following the matter very, very closely. So I will just acknowledge that, as you know, we have here in the Kingston Southeast region had the great benefit, I think, of some tremendous leadership from public health officials, and a big shout out to one of our colleagues, Kieran Moore, who has had great leadership, as well as, of course, the wonderful leadership at our local hospitals and many health professionals across the community who have managed to keep the pandemic relatively well contained. Everyone is familiar, of course, with the fact that there was an outbreak just a few weeks ago, and I think that we demonstrated here best in class response to an outbreak to show what can be done when people rally together. So we're entering now, of course, a period where the province is moving. Most parts of the province are in what's called phase 3 now. Some are still taking a little bit more time and still in phase 2. But we're also in the reality of the fact that there is likely to be a second wave of the pandemic. We are for certain going to see outbreaks that will happen periodically across Canada. Most recently, you may have followed yesterday announcements in Ottawa that there's been a a bit of a mini outbreak that's taken place in Ottawa, with a quadrupling of the number of cases that are taking place there. Those have been largely traced back to indoor gatherings or home parties of particularly younger populations. So I think those are good lessons for us, and remind us of the important work that we need to do to be vigilant, because no doubt we are at risk of similar kinds of things happening, and it's on everyone's mind to try to minimize the possibility of outbreaks. I think the only other thing I'll say before we open up for questions is just that I think we increasingly need to think of the positive aspects of what we have seen happening both here in Kingston, at Queen's, and around the region, around the tremendous collaboration that's taking place between the university, the multiple faculties. I can't tell you how many calls that I'm part of where deans and university leadership are working very, very closely together to address these issues. So certainly as a newcomer, I can vouch for the fact that there's tremendous effort underway to make sure that the response is well connected. We're seeing great agility on the part of faculty members and students and staff to continually adapt, and that's going to be our new reality. That agility is hard to do, but it's definitely happening. But I also think we're seeing, and going forward, I think we'll see this from students as they start to return in larger numbers. We're seeing that incredible spirit of solidarity, and that people are willing to make some sacrifices for the common good. And I think going forward, as we continue to message that, to realize that there will be challenges going forward, but in large part, we have seen this community really do well at recognizing that we all have to do our part, because in the long run, we'll all do better if we are willing to make those sacrifices along the way and adapt accordingly. So I look forward to your specific questions, and I thank you for the opportunity to greet the community today.
Thank you so much, Jane, and welcome again. It is such a wonderful pleasure to have you as part of our community. And thank you, Patrick, for your opening remarks. So we'll dive right into some questions now. It's that time of year again. We're rounding the corner to September, even though, don't panic, there's still a little bit of summer left. But as we start thinking about the fall, there's more and more discussion happening about some functions returning to campus. So to start, I'd like to ask about the process for returning to campus and how we can do that safely. Patrick, can you talk about some of the steps the university is taking to protect employees and students as some of us gradually return to campus?
Great, thanks, Stephanie. It occurred to me when I was talking earlier on that I might have observed that the feat we accomplished back in March, when we all went online and radically changed the way we were doing business, seemed at the time quite complex, but it's nothing compared to the complexity that we face now, getting the institution moving again in the context of the existing COVID challenge and the threat of that to the health and well-being of our community. So it is what we're attempting here this fall, and what I'm confident we will successfully achieve, is a great deal more complex than what we achieved back in March. There's no doubt about that. And even though, as Jane said, we're now in the third phase, along with much of the province, of reopening businesses and places of work. Even so, we're still bound by the fundamental expectations of public health to protect ourselves and to protect our community. So as we think about what it's going to take to bring the university back online as much as we can, we're still bound by physical distancing. There's been some change now in the total number of individuals who can be in an indoor space and an outdoor space, and that will materially alter what's possible for us, certainly. But at the same time, COVID is still with us. So while we think about coming back to something that starts to look a little more like normal operations, we still have to do all those things to protect ourselves and our community from COVID that we were doing all the while we weren't actually on campus. My simple answer to this is that we are not losing sight of the expectations and directions of public health in everything we do. The plan for our return to work is a phased plan. We're trying to coordinate all the different aspects of what it means to bring one unit back online. I mean, it's obvious to everybody that it's not, if you just say, well, we'll resume classes in a certain department, that only begins the complexities. Who will support that operation? Who will be taking care of that building? How many people should be assigned to maintain that building? How often should that building be cleaned? And so on. All of these questions are needing to be considered. So that's why I say I think this makes taking the entire student body online look like a picnic, to be honest. Maybe I'll turn to Mark Green and to Donna to just say a few words about this whole question of how we're working to protect the employees and students during this period of the return. They can be a little more specific than I. Let's go to Mark.
Okay, thank you very much, Patrick. I'm very glad to be here today, and we certainly do take health and safety as a very highest priority. We have had, well, there have always been some, staff and on campus throughout, because there's essential work that has had to be done, and certainly we're very grateful to all of those who have done their part in doing that. And now that we're looking forward, we are focused on the academic priorities first. That is our key mission. That actually it's one of Dean Philpott's first responsibilities is overseeing our medical and healthcare professionals coming back, doing their clinical placements over the summer, and of course needing the staff and faculty to work with them in a safe manner. And so that all of that has been done in accordance with all the stringent public health guidance, working very, very closely with our public health here locally. And David Walker is the principal's advisor on COVID situation, liaising very closely with public health and using best available guidance for the safety of employees, making certain the physical distancing is in place, etc. And we're using we've also used similar approaches for the return into the research facilities, with graduate students returning to laboratories, and also some faculty members, and of course staff to support that. So what we're looking at is applying, now we looked with moving into stage 3, and also planning for the fall, which is only 5 or 6 weeks away before the start of classes in the fall. We will have in all faculties, there will be some graduate courses that are delivered in person in the fall, and certainly in health sciences there will be undergraduate classes delivered, and so we do need to be prepared to support those students who will be receiving their in-person instruction. And so we are looking at a strategy for what level of in-person staff support is required to deliver that safely and effectively, and to ramping that up for September. And another consideration as well is for graduate students and access to office space as well. And so that is something to be looking towards as well, because some are not able to be effective in their current remote work environments. So we also need appropriate support for that. All of it is done with all of the public health guidance, the physical distancing, monitoring ingress and egress. But I think I will pass it over to Donna Janiak to talk about a little more of that specifics, because she's overseeing the campus operations that deals with all of that and cleaning, etc. So, Donna.
Great, thank you very much, Mark. I don't have much more to add. You were very inclusive in your comments. The only thing I would add is that you can go to the BPFA website and the Campus Operations Group website, and there are detailed guidelines there, and they're continually being updated. As Jane said in her opening remarks, we have to be agile, and that agility is paramount because things keep changing. And we do keep updating those guidelines with those public health changes or decisions that the senior leadership team makes on campus activities. And we'll talk about this later. For instance, one of the things that we made a recent decision on was on masks. You saw that in public areas we said it was strongly recommended. We're going to move to saying that it's required. And so those things are always updated based on new information. So I encourage everyone to look at those guidelines to see. We try to highlight what the changes are from the previous versions. But as Mark said, the health and safety of our employees, the community is extremely important, and that's what we're doing in the Campus Operations Group, looking at the specific, there's a very detailed process for those who do want to come back to campus now, and it's very limited, but there's a detailed health and safety review of those proposals, and we're looking to provide guidance for perhaps more people on campus in the fall. So I'll leave it there.
Thanks, all of you, for your responses to that question. And as Jane and others were saying, so much has changed in the landscape around COVID since we last gathered in May. And to what you were saying, Donna, some of the dramatic changes and shifts in thinking that we've seen have happened around the issue of mask wearing. I'm just wondering if you could say a little bit more about the university's policy on masks. So, so will it be mandatory for everybody to wear a mask indoors on returning to campus? And, you know, maybe we can conceive of that happening within our workspaces. What about classroom spaces? What about people who are delivering lectures, for example? So Patrick, did you want to start with this and maybe pass it off?
Yeah, I will. I'll say a few brief words and then I'll pass it along. So yeah. So the decision, as Stephanie rightly observed, the science around masks and the advisability of masks has been a very interesting topic of sort of discussion over the last several months. And I know Dr. Walker has had at different times some questions about the practice of wearing masks. Now the consensus does seem to be that wearing of masks in the workplace is a desirable thing to do, as we know from the province's current directive on the use of, or actually our local directive on the wearing of masks in places of business. So yes, the decision very recently made to make the wearing of masks indoors at Queen's mandatory. What that means in terms of lectures, so we haven't yet spoken about that. So the question of whether a lecturer sufficiently distanced from students should do so while wearing a mask or not is something we will resolve. As I say, the decision to actually make the wearing of masks mandatory was made yesterday, so we will think through the ramifications of this. But let me go to Donna and then to Mark if he has any insights on that latter question.
So yes, the decision was made, and I believe Michael Fraser's not on the call, but an announcement will come out this afternoon on this decision. But so it is fluid. But yes, masks will be required in all buildings and all public spaces. You do not need to wear a mask if you're in your office doing work and you're not, no one's around you. So it is in all public spaces and hallways and so on when there's a possibility. With classes, it will be required. If there's a barrier, so if you have a barrier in front of you and you're dealing with people, then you don't need the mask. And so there's a lot of different nuances. And the thing that we on campus all have to be aware of is that there's some people that are exempt. And so, for us on campus, when we see someone in a building without a mask, I think that for equitable purposes, we just need to be aware that there may be a reason that that person is not wearing a mask, because there are exemptions from public health for those that do not have to wear a mask. Maybe that those will all be working remotely and will not be on campus. The only other thing that I think that I need to add is that Queen's has procured masks, cloth masks, reusable cloth masks, and that we will be providing to every employee and students that need to be on campus in classes. We will have cloth masks for them. And so cloth masks will be provided. Information on how to access those is on the website, but they will be provided. So I think that's all that I need to add. Patrick, there obviously will be lots of nuanced questions as we get into this, when and where and how, but in general, it's in public places you need to be wearing a mask in a building.
Okay, thanks, Donna. I think that pretty well covers that question. Unless, Mark, you have anything you want to add on that?
I don't think so. The only other thing was, I can't remember if we mentioned about where you can get the masks, the ones that the university is supplying. Did you mention that, Donna?
I mentioned that it was the information's on the website, but it's through postal services in Fleming Hall.
Perfect. Thank you very much. And I think perhaps one thing that's worth mentioning, and a piece that has stayed consistent throughout the emergency, is the need for physical distancing, and that where people are taking precautions around physical distancing, we have pretty reliable information about the benefits of that in terms of preventing the spread. So thinking about our return to campus and, what we do with the possible emergence of COVID cases on campus. At our last town hall, David Walker was advising the community about the need to think not only in terms of containment and prevention, but of management when the inevitable happens, when COVID does appear. What are our plans as a community if we do have an outbreak on campus? It could be a student in residence, it could be a faculty member who becomes ill. And then speaking about the classroom, again, one community member who posted a question before our chat today made the point that we don't have a substitute teacher system. So what contingencies do we have in place? Could we put in place? Should our instructors become ill? How have we turned our minds to this?
Very good questions, these. I think what I'd say in the first instance is that we'll continue to be guided, as we always have been, by public health in the way in which we deal with these things. So yes, there's a certain amount of discretion in the way we try to address a problem, but we don't have much discretion in some of the actions that have to be taken. So that in the case of an outbreak on campus, if the student is in residence, we have now the capacity to quarantine that student as necessary and according to the public health guidelines. And then presumably we would engage in all the normal contact tracing in order to manage this case the way we'd manage cases anywhere else in the community. So I think we're in a good position to deal with the inevitable there, Mark can talk about the capacity in the residences and the whole approach to the residences that empowers us to deal effectively with a case should it emerge in residence. If a case were to emerge in the student body, but in the case of a student who's not in the residence, then there would be, of course, the same sort of expectations that would apply to anybody in a private home. On the question of our not having substitute teachers, it's a really good question, but the point I'd make is that even before COVID, we had no substitute teachers and people still got sick. So I think the members of the professoriate need to just think perhaps a little more intensely than we normally do, because the odds of getting sick are slightly higher, about what we do to ensure that our students' learning continues. Even should we become temporarily indisposed by illness. I think it might be a prudent thing to do to actually think within departments about how to prepare for that eventuality and who might be willing to stand in for who else in the department should they become sick. I think this is one of these cases in which perhaps COVID will alert us to the desirability of certain kinds of practices that would be good even after COVID is gone, to think creatively about how you ensure that your students are looked after and the course is covered should you fall ill. Mark, any comments on either the residence question or the latter question?
Yes, certainly. Thank you, Patrick. Yeah, they're both important considerations, and that we have been heavily engaged with. Certainly, from the residence situation, there is a very robust plan that, for example, with the residences, our capacity was determined based on having a separate quarantine or self-isolation space for any students who became ill. Another consideration is that students will only have individual rooms, so there would be no sharing of rooms to reduce contacts, and that the maximum with fixtures for washroom facilities, etc., is that maximum of 2 people will share the same sink or toilet, etc., shower, so that then you'll have designated spaces, and so that will reduce any contact, so people can be self-isolated if there happens to be a case. And I know there are other implementations in for those who, the undergraduate programs on campus, such as in nursing and in medicine, they're also using group cohorting as well. And that's combined, keeping, say, the nurses together in residence and in the classroom. So then that also mitigates in terms of contact tracing, etc. Makes it easier to do that by having that cohort model. With regard to the replacement of teaching, one of the things that we have very much encouraged is with many of the learning in the fall being remote, is implementing asynchronous options. So pre-recorded lectures that can be recorded in advance, etc. And if that's in place, then those asynchronous activities can continue when a faculty member or instructor becomes ill, that could be monitored by somebody else if the person is ill enough that they can't do that, if they have to be hospitalized, etc. Quite often departments, perhaps another faculty member would step in to cover, perhaps a teaching assistant or a teaching fellow to do a lecture, etc., as needed if there are synchronous elements that are essential in those things. And those, as Patrick had mentioned previously, that's how we have managed in the past. Different illnesses, etc., or people being away for conferences, etc., during term. So that we think that it would be manageable, but departments and individuals do need to think a little more proactively about being prepared and having things available in case something happens suddenly. Oh, you're muted, Stephanie.
I think, Patrick, you want to...
Thanks, Stephanie. I actually wanted to turn to Jane and invite her to talk a bit about the whole issue of how to approach outbreaks. I mean, because we have been so fortunate in this city, we haven't a whole lot of experience of dealing with them, except for the recent nail salon cases. And yet, I think it's really important for the university community to have a healthy understanding of the likelihood, the certainty of outbreaks, and the spirit in which to approach these things, because we're entering a phase in which, yes, the disease is going to emerge in our community, and that can't always be the thing that triggers a total shutdown of the institution. We have to have a way of approaching COVID that is realistic, given the nature of this from an epidemiological point of view. Jane?
Thank you very much, Principal Deane, for asking me to comment on this. And I think others have alluded to this before, but I think one of the best things we can be doing and are doing is the work to both prevent possible outbreaks and prepare for possible outbreaks, recognizing that we all know that they will happen. It would be unrealistic to assume otherwise. I want to thank Stephanie, who had her medical hat on when she talked about things like physical distancing. And we have to sometimes just go back to those very basic, simple, affordable techniques that all of us will need to be vigilant on for months to come. And I think everyone's getting very good at that, but trying to always emphasize that even though masks are going to be now more required generally in indoor public spaces, nothing substitutes for keeping our distance. And that's not always possible, and that's why we need to use masks. But the very first line of defense is keeping our distance. The other thing that I think would be worth saying is the preparation for those possible outbreaks. And here's where, again, we require tremendous, I would say, professionalism, personal responsibility of people to acknowledge that they all have a role to play. So one of the things that we are already doing, I think pretty much across campus and certainly out in the community, people have seen the questions that they are greeted with as they enter buildings. We're actually looking at mechanisms for how we can document and ensure that as people are using campus facilities, that they are going through those public health directed questions and taking the personal responsibility that if they have any symptoms, that they will stay home. If they have traveled somewhere to a high risk zone, that they will self-quarantine accordingly. And then we're also doing work to make sure we know where people have been. And you'll notice this as people have gone to restaurants and outdoor patios that they are taking some information about who is there. And we're working through mechanisms to be able to have that same kind of information. So as you said, Principal Deane, when we do have an outbreak that might occur on a certain floor of a certain building on campus, we won't have to shut down the entire university. We will be able to work alongside public health, who are experts at this, to be able to say, based on the information that we have, as well as class schedules, as well as, for instance, in our faculty, we have some researchers who have returned to the laboratories. We know with a fair degree of certainty who has been in a building on a given day at a given time, and that's how we're going to be able to have that precision response to say, some buildings can continue, another building where an outbreak has taken place will mean that everybody has to go home for a couple of weeks. So a lot of that work, I think, we are getting better and better prepared for, in order that we can manage those outbreaks accordingly and keep the educational work of the institution moving along with minimal disruption.
Thank you so much for that, Jane. I'm going to turn now to the questions in the Q&A, and again, the questions that are coming in are great. Unfortunately, we will not have time to address them all, but we will try to address some and group concerns as best we can. So we've covered as many topics as possible, but maybe just in relation to what you were just talking about, Jane, Patrick, and Mark, around contingency plans. Can you speak a little bit to how we are communicating with the City of Kingston around this planning? Obviously we have a very important and strong town-gown relationship. Can you talk at all about any conversations that have been happening with the city? And then relatedly, we have a question about the challenges that may be faced by commuters in the city. So have we talked about, for example, physical distancing on public transit, reduced transit fares, parking spaces, if we're asking people to rely on private transportation? So just wondering where those city conversations have gone and are going.
An excellent set of questions, because on this issue, as on a number of the others we face, for example, the racism questions, we're an embedded community. We're in a larger community, and the decisions we make affect that community and vice versa. So we have worked very closely with the city. We've mentioned many times, obviously, public health, and that continues to be very strong. But with City Hall itself, we're closely in touch, and we've worked with City Hall on a number of issues from the very beginning of the COVID crisis. I think the city is keenly interested in what happens at Queen's, because as some merchants in the city said to me some time ago, whether or not the students are back will have a direct impact on businesses in the city of Kingston and on prosperity and well-being of that sort in our community. So the city itself and business people in the community recognize that their future is closely intertwined with what happens at the university. And we recognize the inverse of that, which is that decisions we make will have an impact in the community, and therefore need to take into consideration that impact before we set the wheels in motion on any particular issue. It's an interesting aspect to our relationship with the city that over the last couple of months, as we've moved from sort of lockdown towards progressive opening up, the prospect of students returning in significant numbers to Kingston has gone from being a very positive thing in the views of many citizens to being a more problematic thing in the eyes of citizens, for the simple reason that a large number of those students, in fact by far the majority, come from communities remote from this one, and therefore are potentially vectors for the virus. And so this is a very complex moment for the the university in the city and the city, because what is good for the city is also challenging to manage from a public health point of view to ensure that everybody stays healthy and safe. I mean, we believe it's possible to strike a balanced arrangement and for us to manage our affairs in a way that doesn't threaten the community. And I think the city is keen to facilitate that in any way possible. But it is very challenging and made more challenging by the fact that we expect large numbers of students to be in town who are not physically in class in the fall. So they will be in Kingston, but not live in the classroom, if you see the distinction. And that means a certain number of students would be sort of somewhat beyond the reach of the influence of the university in their behavior and so on. So it's a very complex question. But to answer the question as it's been put directly, yes, we're working very closely with the city and will continue to do so for all the reasons I've laid out. On the question of commuters and transportation in the city, these are not issues on which I'm expert at the moment. I can't really give you much of an insight into what the city's thinking about these things, but I know they are, and we do know what the way in which on public transport at the moment prudent measures have been put in place to keep people safe. So I assume that will continue in a way that's appropriate to phase 3 in the fall when we get there. Let me see, is there anything else I would say before inviting Mark or Jane or Donna to talk? No. Jane, how about any comments from you on this relationship?
Well, thank you. I don't know that I have too much to add to that in particular, but of course, one of our city partners that we maybe haven't mentioned so much is our hospital partners and the health and medical community. And I can certainly reassure folks that that there is a very deep and close connection and coordination that takes place. I speak to our hospital partners pretty much every day. And we certainly are making sure that everything is in lockstep in terms of what's happening on campus and the university. And I think that's a huge advantage that we have here at Queen's, is that the hospital partners are so ready to step in at a moment's notice and are managing this with, I think, absolutely the best in class response and coordinating it well. So again, you know, there is a desire to make sure that we have a comprehensive approach to this, that people have other health concerns, as some have alluded to earlier, and we need to think about the comprehensive well-being of students, staff, and faculty. And the hospital has certainly faced that as much as we have, in terms of recognizing that they need to move on with the business of providing comprehensive health care and not just health care for people suffering from COVID. So that's one of the challenges I think people should be aware of that they're facing. And I think it's good that they are, like the university, starting to try to reopen things and deal with the very serious backlog that has taken place along the way. But as it relates to their partnership with us at the university and being ready to deal with an outbreak and to provide that care, I cannot imagine that there's a place in the province, let alone perhaps the country, that has that same kind of deep interconnection. And I think that's a huge asset to the Queen's community.
Great. Thank you both for your responses. Still on the topic of COVID, but switching gears just a little bit. When we gathered in May, we talked about how fundamentally this pandemic was changing our relationship to work. And I think we're all learning a lot about ourselves and how we work best and how we prefer to work. And, you know, for some people, you know, we're thriving in this remote environment. And for many of us, working remotely, particularly when we have family responsibilities, is incredibly challenging. So I'm wondering if you could comment on a couple of things. One, for those who are parents, you know, what can they expect if schools and daycares do not reopen in September? Will there still be possibilities around working from home? And also for those who live with elderly parents or other family members and have concerns about risk to the health of their family members if they were to return to campus and interact with others on campus. What are the possibilities available to those staff members?
Thanks, Stephanie. All of these important questions. Before I get to them, just if I could, two notes. One, I know Jane has to leave us within minutes. So thanks very much, Jane, for being with us today. Really appreciate your contribution. So Jane will slip off quietly, and I just thought I would let everybody know that that's expected. And then if I could, because I'm going to turn to Donna at the end of what I say about this issue, but if I could perhaps signal to Donna too that I'd welcome any comment from her about the city question that we just dealt with, because I know Donna has a great deal more knowledge about certain aspects of that than I do. So if I could then, I'll just turn my comments to some of these HR questions about conditions of work and so on. I think one of the great things that should come out of this COVID experience is a radical openness to different ways in which we do our work and different locations in which we do it, and some fundamental and I hope more humane shifts in the direction of the relationship of our working lives to our private lives. We all work in the context of, I think, a slightly dehumanizing assumption that in order to do your job, you have to leave your home and your family and those obligations behind. And I think what we've all learned from COVID is that actually you can't. It's an artificial separation. And what we need to do is think about ways of doing our jobs that are compatible with our other obligations as human beings. So I can go straight to that question about what will be, what parents of young children should expect, or people who are living with elderly parents and so on once we return. I think people should expect the university will continue to be flexible and open to different ways of working. I imagine many of us will be working from home for quite a long time. I mean, if you look at our principles for decision making during the COVID, I mean, our presumption still, even as we look towards a fall in which there will be more students on campus, is that the default is that people are working from home until we are at a point at which we are confident that anybody who wishes to be on campus to work can do so safely. But even once we get to that point, I think it'd be very important for us to think in an open way about different ways of doing our jobs. I know from looking at the questions, lots of people find they've been more productive at home, and those people should be encouraged to continue to work in that way, I think. On the other hand, for some people, it's been a trauma because they've had very significant obligations at home with the schools closed and so on. It's been very difficult for many people. And there again, I think to the extent that the university can be helpful through flexibility, we must be flexible. So having said that, maybe I'll hand over to Donna.
Thank you, Patrick. So just a reminder for everyone on the call that both Stephanie and our Associate Vice Principal HR, Stephen Milan, worked on a memo that went out to everyone, and it's on the website, about flexible working arrangements for staff with caregiving responsibilities, which covers, you know, all aspects of what we were asked for in the question. And absolutely, the key is flexibility. So we do have that. We do have guidance for all managers, for all employees in those circumstances. And please reach out to Human Resources if you have any specific questions. But that is the premise, that we are going to continue to be flexible and accommodate staff that with these responsibilities to do their work from home under the current circumstances. And so, you know, which is flexible hours, reduced response, you know, there are a number of different arrangements that can be put in place to accommodate staff. There's also on the faculty side, I believe it's Schedule C to a memorandum of understanding that was signed with the Faculty Association in terms of flexibility for faculty. So arrangements are in place, and we will continue to do that. But I think everybody should be talking to their managers or following up with HR. But that is the key, is flexibility. And as Patrick said, going into the future, you know, we are looking at what needs to be done on campus versus, you know, what can be done, continue to be done remotely.
Excellent. Thank you very much. We really need to switch gears here now and talk about what you spoke of in your early remarks, Principal Deane, about the Black Lives Matter movement and the voices of students that we are hearing loud and clear, those who have shared their stories very courageously in the Stolen by Smith Instagram account, the Erased by FEAS account, and so on. This continues to be an enormous problem on our campus, and a number of people, both previous to the town hall and in the session, have identified this as a crisis on our campus and wonder why the university, if it has not done so, has not recognized it as such. And so I'll just read a little bit from one of the posts that have been made in our Q&A. COVID-19 was correctly identified as a crisis. The response from Queen's was centralized, quick, and decisive, drawing on and bringing together expertise from all areas of the university. Why has the response to racism not been characterized as a crisis? And why have we not seen the same centralized, quick, and decisive action in tackling it? So there's a lot here, but I'm wondering if you're able to speak to the issues generally and maybe also in response to some of these specific concerns.
Thanks, Stephanie. I'll start by saying straight out that I think it is a crisis. I think there's no doubt about it. It's a different kind of crisis from the COVID one. It involves more pernicious social forces and currents than the virus, but it is a crisis, and it's a crisis for all kinds of obvious reasons. This institution we've come to the end of the Picardy process, which predates me. Lots of people in the institution did a great deal of work on it. By comparison with other institutions, there have been structures put in place here to encourage people to see the world of the academy through an equity lens. We've done quite a bit, I would say, and yet the evidence that we have in front of us this summer, Stolen by Smith, the similar process in engineering, the examples of vandalism at Four Directions, all of these things speak to a racist culture that's alive and well around us and within us to a degree that is very, very concerning. So there is a lot that has been done. My assertion as someone coming back to the institution after 9 years away is that we've done the easy things. We have now the very difficult things to do, which have to do with human attitudes, issues, curricular issues around, you know, the way in which our curriculum props up racism or cultural chauvinism of one sort or another. We have to get to the point at which we're asking and acting upon questions that are much more corrosive than our institution, or pretty well any Canadian institution, has asked yet, because the history of our institution, as pretty well everyone in Canada, is tied up with a history of colonialism and racial oppression. And we have to begin to untangle the entity itself, the institution, from that history and that ideological framework. Saying that is easy enough. I mean, anybody who is active in these issues, and I know many people on the call feel very passionately about this and are active in the cause, everyone understands that human nature in its operations of this sort is hugely difficult to change and to challenge. Ours is a human institution with all the complexity of human behavior. So the way I look at this crisis is that it requires a robust, aggressive, longer-term plan for cultural transformation, which will depend on very forthright and strong measures at the curricular level in terms of hiring and those sorts of things. And then it will take also short-term measures which directly address some of the immediate concerns. The situation in Smith cannot be fixed by a single commission of inquiry. That is a situation that is the result of a long history that has not been attended to. And the solution will not come quickly enough for any of us. However, everything we can do in terms of measures, short, medium, and long, has to be done. And the last thing I'll say about it, and I know Mark has very strong feelings about this issue, and I'd like him to speak to it as well. The issue when racism occurs is often spoken about as though it's some alien force in the university. But that is very misleading. The problem is us. The problem is in the institution. It's in our history, it's in our attitudes, it's in our processes. And it'll take a particular kind of self-awareness and toughness to eradicate it. Mark, can I invite you to say some things about this?
Yes, thank you very much. Yeah, Nargoa. I mean, it is a crisis, and it is something that it's a crisis, or it's a cancer that is embedded deeply in our society. I think one good analogy in the COVID situation that applies is that our protection in the COVID crisis relies upon each individual doing their part, maintaining their small social groups, maintaining physical distancing with others. The same responsibility applies to in the racism situation. As leaders, we can talk about what the values are and what needs to be done, but I think the responsibility also lies with each individual to examine their daily actions, their daily interactions with others, to become aware of what some would call microaggressions, other activities that happen in daily lives, and how that frames the racism that's in our society and in our institutions. That work is very, very difficult. It actually means for many people that they have to give up with long cherished assumptions about what Canada means as a country, what are the myths about Canadian society or Queen's society, and what is and how then their individual ideas, values mesh within that. And some will simply say, well, all of this is just political correctness. That's what's often done in the past. And that it's perhaps then infringing upon free speech or freedom of expression, etc. Hopefully with the way the dialogue is right now, that more and more people will recognize that it is more than that. It is about challenging some of these basic tenets that are in our society. And so I think that there is a lot that we in the university can do in terms of leadership, in providing the educational tools. I know there are lots of people who have been heavily engaged in this work. I know I've worked with Stephanie and Jan for over 20 years in these areas, and I continue to work with them specifically in moving forward on this. But it does require a lot of tough and difficult conversations. In some environments, people can be very resistant and feeling that, unfortunately, there's often a lot of guilt or blame associated with, and I think that's something to get over with as well. That it's not so much about calling somebody a racist or whatever, but recognizing that perhaps, although it's not intended, that the person's actions are racist because it's embedded within the society. And that's not about that individual being a bad or negative person, but it's still a racist effect. And I think these are a lot of the difficult discussions about, but I think everybody, I encourage everybody to become engaged in that work. And I will do my utmost to provide the, guidance of ways that people can engage in that work, and training for both staff, faculty, and students. In that, I think we have done a lot in terms of responses to the TRC task force, a lot of the Indigenous awareness training. The Kairos blanket exercise, for example, has been quite effective in I think transforming people's lives and their viewpoints in some of these areas and Indigenous issues. And I think there's much more that can be done in for anti-Black racism, etc. So it's certainly something that I feel passionate about, as Patrick has mentioned, and look forward to continuing that work.
Patrick, I saw that you'd raised a hand.
Yeah. Thanks, Stephanie. I just wanted to first of all, to thank Mark for his strong position on these issues, but I wanted to remind people that the conversation that's been going on, initiated by me last October, is very much enmeshed with this particular question. There's no way that the conversation can come to a satisfactory conclusion without reckoning with this question. Because the question I posed when I started the conversation was basically, what kind of an institution are we, and what kind of impact do we wish to have in the world? And obviously, the whole question of racism in our community bears directly on what kind of a community we are, and I can't imagine in what universe one would see that as a desirable kind of community. So I encourage everyone, as we continue, the conversation will move in a different direction later this summer. I encourage everyone to engage with it with regard to this topic, because here's the corrosive question I will put to everybody. I think it is the case with our institution that much of what we think defines it lies at the root of what we're complaining about here. And we need to ask ourselves that question and confront it, and then redefine ourselves by other means that are defensible and ethical. I was saying earlier on about the way in which kind of human societies have trouble dealing with these issues, and here's the fundamental reason. I mean, the racism question at Queen's bears directly upon decades and decades of the way in which we imagine ourselves and the experience of our students and the contribution we make to the country. We have to be ready to radically rethink all of that. It'll never be an easy conversation, but there's no way out unless we can actually tug on some of those threads of which many people are extremely fond.
Thank you, both of you, Patrick and Mark, for addressing this. I was happy to hear both of you speaking both about redefining ourselves and our culture, and also the role of leadership in this, because I think that that's what people are looking for, is leadership on this. And it's an incredibly painful moment for many people. I can hardly begin to speak about it. These experiences resonate with me. And it's important to recognize that there's a tax that people pay for coming to Queen's, and that's what people are trying to bring to our attention. There was a really important case around sex discrimination and sexual harassment that happened in the 80s, where the decision makers spoke about the gamut that women were forced to run into place. And I think that we need to turn our minds to the gamut that people need to run to be able to participate in this community, and that it's fundamentally unfair. We need to work at addressing this in very concrete ways. So thank you both very much for that. Patrick, time for closing remarks. Unfortunately, again, I apologize to people who have raised a number of really great questions in the chat. As Patrick was saying earlier, there will be efforts made, I know, as part of the principal's office, to ensure that we have addressed these questions in other forums and other ways. But unfortunately, we need to begin to wrap up. So, Patrick, do you have any closing remarks that you'd like to leave us with today? We've covered a whole range of things.
Thanks, Stephanie. I wonder, would it be possible, I'd like to invite Kim to say just some words about research before I do some summing up. I think a sense of where the university's research enterprise is and what, in terms of what's coming back online, would be helpful, and then I will make some closing remarks after that.
Hi, everyone. Thank you very much, Patrick. I think that the research continues to go apace. People are coming back into the laboratories and through the faculties and the departments and other units. We've managed it quite successfully. The one question I would like to mention, though, that came up around the masks is if you are in a laboratory by yourself, as Donna has indicated, this is for the masks are for the common areas. You don't need to be wearing a mask unless it's required by the work that you do, and unless you can't physically distance. So other than that, Patrick, I think the research is moving along very well, and people are continuing to follow the rules. We have good flow through the building, so it's going well. Thank you.
Thanks, Kim. So thank you everybody for coming, and sorry that we didn't get to all the questions, but we'll try to get back to you on those. It struck me, you know, as we were talking today, I mean, it's got to be an unprecedented period in the history of our institution. The internal challenges are enormous, to say nothing of the COVID context in which we're trying to do it all. I'm full of admiration, actually, for the way our community has managed the COVID crisis, and I think we're heading in a positive direction with this. I have a great deal of optimism about our ability to navigate this and to come through the crisis heading in a direction we like and retaining some of the good things that have been implemented during this period, and restoring some of the things that have been lost. I think the bigger challenge, frankly, is the culture challenge that we've been talking about towards the end of the town hall here today. And I actually think this is the right kind of moment to describe as a crisis, because I do think that the future well-being and success of this institution and the future of the contribution that we all wish it to make to the building of a just and better society in this country is in the balance. The credibility of the university hinges on how we deal with this issue, and our success on transforming the institution in order to do that. A lot hangs on that. I think our future as an institution and our credibility as an academic institution depends on it. There again, I'm optimistic because there's a great deal of goodwill and a lot of people working very hard in the institution. At the same time, though, we have to insist from all of us a very high degree of self-awareness and self-criticism, and to think about the role we all play in impeding, slowing down progress on these issues, or areas in which we might actively contribute to a resolution of them. So this is a critical time for us all. I feel very, very privileged to have this role during this time, and I hope we can together resolve not only the internal question, but the bigger question, and come out of it a stronger and better institution on the other side. Thanks, Stephanie.
Thank you very much, Patrick, for providing us this opportunity today to have these conversations. Some of them very difficult, but all of them very necessary. And I want to thank everyone on the call for joining us today and taking time out of your busy schedules. I do want to remind people that the session has been recorded and it will be posted to the principal's website, hopefully tomorrow. And I also just want to, to picking up from what you were saying, Patrick, to encourage people to take care and to stay well. We're dealing with some incredibly challenging issues and times, and so I just want to remind people about resources like the Employee Family Assistance Program and counseling supports that are available to people as you navigate many things, as well as student wellness supports for students. And of course, I think that everybody on this panel would encourage members of the community, if you have particular concerns, to reach out to our various offices if there are additional things that that you'd like to address. And I think that that's it. And I'd like to turn it over now to Jan Hill to provide us with a closing. Thank you all.
Thank you again, Stephanie, and thank you everybody for all of the difficult and amazing conversation that's been had today and for all of the information that's been provided for all of us. I echo the principal and Stephanie and everyone else in wishing us all the best in the hard work that's ahead of us, especially as we deal with the culture of our community. So in the same way that I brought all of our minds together at the beginning of the session, it's my tradition that now it's important that we separate our minds so that we can carry on in a safe way and go about our business, not being stuck in this place, but understanding that it's time to move forward from this place to the next bit of our business. So, Kunjokwa, Sawadahusio, Skani Gariwasa, De Chirabanu Horado, Ne Sungwaya Diso, Ne Wahi, Rosa Anyo, Ne Gari, Ne Ohandu Gariwadekwa, Ungawana Hetstu, Ona, Sawadahusio, Kunjokwa, Ne Gari, Ohandu Gariwadekwa, Ungadi Wanungode. Agwego Unska, Andiwa Wait Nuni, Ne Ungot Nikura, Dano De Tinuarado, Ne Agwego Yumpieno Ase, Gio and Jade. Agwego Unska, Andiwa Wait Nuni, Ne Ungot Nikura, Dano De Tinuarado, Ne Agwego Yumpieno Ase, Git Karun Jade. Dana Ona Gardi, Agwego, De Chidawanu Horado, Ne Sungwa Disu, Tos Neodunhaks Ne Zewat Nigura. Many thanks and to all of you for your attention and your patience, and I hope that you all continue in good health and good spirits. Take good care.